I'm Sharon Hirsch, and I serve as the CEO at Positive Childhood Alliance, and this is?
I'm Beth Moore. I'm the Learning and Development Director at Positive Childhood Alliance.
We're really excited to be with you all this morning. We'll be talking a little bit about who we are and what we do, and our focus on building a family support prevention ecosystem for our state. And then we'll be talking about a framework called HOPE, Healthy Outcomes from Positive Experiences. You heard a little bit from our last presentation about positive childhood experiences, but we're going to take a deeper dive into that with you this morning. So we're the Positive Childhood Alliance. We are focused on advancing policies, programs, and practices that support well-being for all of North Carolina's children and families. We're the state chapter of Prevent Child Abuse America, so you may know us as Prevent Child Abuse North Carolina. This year we rebranded because we really want to focus on what we want to see for our children and families instead of what we're trying to stop. We know that the science tells us that the general public can get motivated and inspired and see their role when we focus on what we want to see, and can get overwhelmed when we try to talk about the big issues and concerns that are really feel like big, intractable problems. But we know childhood adversity is a preventable, solvable public issue, and that's how we approach everything that we do. And our vision is that all children and families are living a purposeful and happy life with hope for the future. It is language that comes from what families told us they want, and it is very not clinical jargon. And so we'll talk a little bit more about that. Our values are equity, community-wide responsibility, which you heard a lot about already this morning, partnership, because we know no one agency, one family can do the work by themselves. We all need support, we all need help, and everyone has a role to play. And we're very data-driven in the work that we do. Everything we do is based on what the science and evidence tells us can make an impact. Our three core focuses are on advocating for policies that support families. We are focused on things like paid family leave and making sure families have the resources and supports they need. We're making sure that we have a family support system that includes robust family resource centers and access to home visiting and parenting education and other supports that families need to thrive. We're focusing on building a new understanding about what families need to be successful and helping to change the narrative, and that's why we changed our name. And then finally, we partner through coaching, convening, and collaborating with folks like all of you, with agencies all across the state. We help to support the delivery of evidence-based parenting and family support programs like Incredible Years and Triple P. We have a whole team of folks that provide training and TA for those. We also do a lot of community-based work that helps us bring communities together to talk about what their goals are and how we can solve problems, and then we help with technical assistance and consulting to help communities move from their plans to actual implementation and make those dreams a reality. So our work, this is probably very hard to see for you all in the back, but we're now operating under this new theory of change that was created by Prevent Child Abuse America. It's a theory of change for how do we create a family support or primary prevention ecosystem for our country. We know we have a child welfare system. We know we have a juvenile justice system. We know we have a healthcare system. We do not have a family support ecosystem in our country. We spend most of our resources downstream trying to address problems that have already happened instead of supporting families from the start. So this theory of change is based on how do we bring all of the folks and agencies together that are in this ecosystem for family support together and focus on what families really need. So we're talking about aspirations like making sure all families have access to informal and formal supports, that families are able to achieve financial stability and economic mobility. We're focused on mental health and family well-being. These are the things that families said that they want for their kids and families. And we are talking this fall with agencies all across the state as we develop a strategic plan that helps us implement this theory of change for our communities all across North Carolina. We want to move from a state that's spending more than $4,000 every single minute on the downstream consequences of childhood adversity to a state that's investing first and foremost in our families, that makes sure that we're providing paid family leave, that we've got minimum wage jobs that are paying a living wage, not just a minimum wage, that we've got access to housing for families, and that families can access the support they need when they need it, no matter where they live in North Carolina. That's our vision for moving our state forward. So this, again, are those 4 aspirations. The one that I didn't mention was mental and physical health and well-being across the lifespan, and then loving and secure family relationships supported by foundational life skills. Now, when you look at those things, I want you to remember that those things are not rocket science. These are just things that many of us that have grown up in middle-class households have had, and we want this for all of our children. Every child in North Carolina deserves to have access to all of those kinds of supports. Our work is also framed in the science of the positive. You heard our name as Positive Childhood Alliance. The science of the positive is a real science, and it's not woo-woo, it's not the power of positive thinking. It's this idea that if we can focus on what we want to see and where we want our communities to be, that we can make that change happen. And it's guided in this circular concept of always starting with spirit. And that is really about focusing on what we want to see and what kind of vibe we want when we're working together. We want to be positive, we want to be hopeful, we want to be focused on possibility and promise. We focus on what the science is telling us, both what's currently happening in the community, looking at what the data and evidence show us, but then what we know about what it's experienced in other communities that we can bring in terms of policy and practice that we know has made a difference. So for example, we talk a lot about how concrete economic supports, financial support, and family financial stability can do more to prevent child maltreatment than a lot of the programs that we have invested in over time. If families have access to resources and support, they're not overloaded by the stresses that can cause them to experience adversity. Then we move into action, and we talk about the things that we can do and how we support the community, and then we spend time reflecting on that and thinking about how it went and how do we get better at it, and we follow that cycle over and over again. It is really what's guiding our work moving forward. But now we want to talk more about the HOPE framework, and Beth is now a certified trainer in the HOPE framework, and she's going to lead us from here.
No, I get to spread some hope, Sharon. So we tend to focus on the negative, right? I was thinking, even driving in today, I was thinking, wow, so much of the work that I've done in the past has been focused on the negative. The family will present themselves and oh, that child's got a dirty diaper, you better get them to the diaper closet, or oh, that child's got dirty clothes, or the family's water got cut off, or oh, this is going on, that's going on, and the mom's got a drug problem, like all these things. But what if we flip it? Right? What if we flip it? What if we look at the positive? What if we look at the strengths of that family? What if we say, there's so much more to that family than what they're presenting of? We're shifting the narrative. The hope shifts the narrative. The hope says that grown-up needs support. That grown-up maybe has a high ACE score. Okay, yeah, sure it does. Sure those negatives are occurring, and there's so much that can be done positive. There's so much that we can do to prevent and promote the healing. So even if that childhood was really, really tricky and really, really horrific, and we know it is, we know that is happening, there's still hope. And sometimes that was missing for me when I was in family services. I got a little burned out, and it was hard. How many, I just need to get a little feel for the room, if that's okay with y'all. How many people are in direct service in this room? Oh, did anybody tell you thank you today? Thank you for what you're doing? Like, seriously, thank you. It's really hard. And I mean that from the bottom of my heart, because it is hard. So thank you for what you're doing, and what you're doing is important and it matters. Systems friends? Anybody in systems? Okay. Great. And then like other friends, justice, lawyers, healthcare. Okay, great. Thank you everybody for all the work you're doing for families and communities. Because again, like people don't tell us thank you a lot at all. They sure don't. So anyway, back to, I digress. Sharon, keep me on track.
I will definitely keep you on track. I also, as we start this conversation, want to also reinforce about the science of the positive, that when we focus on that, it doesn't mean we don't acknowledge the negative. It doesn't mean we don't acknowledge the concern. We actually, that's why we're focusing on what we want to see. We know that the positive and negative are always with us. And in our society, especially right now, the negative is really, really loud, isn't it? The negative is really loud. What we want to do is grow the positive and get us tilted in the other direction so that the positive is louder and can be making a big difference for families. You want to take the...
Oh, jeez. She's let me have the clicker, y'all. Get excited.
You have the control.
I know. So what if we lived in a world that recognizes and honors and promotes that positive and that hope and that spirit that says that families are capable, that adults are capable, that kids are capable, that communities are strong? Like, what would that look like, right? What if there was a way that we could do that? Is that even possible? It is. I promise it is. It's possible. You're starting that work already with that resilience, recognizing there's ACEs. And we don't have like a ton of time for us to go into it, but we're going to give you a tiny little taste and a little bit of hope. And then hopefully, you're going to keep taking that hope out there. And then if Sharon and I do our job today, you're going to start being able to flip things and notice that positive just a tiny bit. And it grows. Because I've noticed it even just like over the last couple of months. And like Sharon said, the science of the positive, it's not like, it's not that woo-woo stuff.
And it's also not rocket science.
No.
It's common sense if we focus on what we want to see.
It is, and it's the way that we frame it. It's the way that we, okay, well, let's just get into it before I just keep, see, this is why they don't give me the clicker. All right, pop quiz. Was everybody in the keynote before? Okay, good, so everybody should get 100. How many people have heard about ACEs? Yeah, we all did, yay. How much do you know about it? Are experts, mostly a lot of experts? Perfect. I was in a group a couple months ago, and they didn't hear about it at all, so there's still work that needs to be done, of course, with ACEs, right? And we did hear in the group, in the keynote, like ACEs is still a thing. We need to do a little bit of work around ACEs. I'm not going to go into a whole lot because we did hear about it. You're experts. Here's a cool slide, though. This is one, it's like hard to see.
Well,
We
can walk through it. So this helps us understand the different categories of adversity, and they include traumatic brain injury, fractures, and burns. It can include depression, anxiety, suicide, and PTSD. Unintended pregnancy complications and fetal death. You think about how hard that is when a family experiences that. HIV and STDs. You want to go through the last
Chronic
three?
disease, cancer, diabetes, the risky behaviors, that's the one we knew the most about way back when. We knew that if you had a tricky childhood or a challenging childhood, that you were more likely to engage in alcohol and drug use. So that one we knew, unsafe sex practices. We knew that one a lot, but there's some more information about that. But opportunities is the one that gets me a lot. You have a lower opportunity, lower income, even just from having a high ACE score. So I kind of like the way that graph is set up for people that maybe not have seen ACEs before in different sectors. It seems to resonate for people who have never heard of ACEs. That slide seems helpful.
And it really helps you understand that it's not just about those health issues that we hear about in the resilience documentary. It goes bigger and deeper.
Yeah, it sure does. And across so many sectors, like across so many parts of our lives. So then we think about positive experiences, and this is not just for children. Yes, children need positive experiences, but adults need positive experiences too. So we think, you hear PACEs, like positive experiences for children, but adults need fun things to do. We need health and well-being. We heard it at the end of the last speech as well. We need wellness in our lives.
And it's really important because, as Beth has taught me, our children don't come without adults.
No, they don't come
They
without
don't.
grown-ups.
And so if the grown-ups are doing okay, our kids are going to be better, and they're going to thrive. So we can't forget that it's really important to take care of the adults and caregivers in children's lives because they're the key. If we just focus on the children, we're missing a really critical piece.
We really are. And so what I know about kids is that if the grown-ups are well, the children are going to be okay. They may have some things that we have to address, like if there's is there any early educators here?
Over here.
Oh, yay! I love my little preschool rock stars. We may have to address some early learning issues or whatnot, but if the grown-ups are well and supportive, then the children are going to be okay. It's when the grown-ups are not well that we have a lot of neglect, and then unfortunately it follows into abuse. So we do want to provide skills and build skills that promote wellness and then ultimately resilience and success, right? Success looks different for a lot of different people too. Well, my idea of success is going to be different than what Sharon's looks like. And belonging. So how do we get there? We want to give equal attention to growing the positive. We want to make sure that we provide that unbiased, empathetic care. And that's tricky sometimes because we all come into this work. Who doesn't have any biases?
Who's never judgmental? Because we all are.
I'm so glad they're telling the truth today. Yes. Not always. Like, we come into groups sometimes they're not telling the truth. But yeah, so we all come in with some biases and judgment, and it's hard to put that aside. It's hard to be like, when we see such trauma and such crisis and such, like, oh my gosh, if you just did X, Y, Z, that wouldn't look like that. We see that when we're working direct service. It's hard to put that aside. But when we come in with that unbiased, empathetic care, then we can start to really promote some positive. Keeping unfair blame, right? Unfair blame is just what it sounds like. I don't know what happened to you. I don't know what happened to you this morning. I don't know if you got stuck in traffic. I don't know if somebody yelled at you. I don't know what happened to you this morning before you came into the office or before you came to this presentation. And so to have that positive intent for people that are in front of you, to have that, okay, well, yeah, let's take it down and kind of talk about this together and think about what we can solve together. And then building that trust between humans, really, just building that trust between humans and helping to increase and use their strengths, right? Everybody's got a strength. This is all stuff that we do. They've just kind of spelt it out, which is really nice, right? Is everybody from Wilmington here? That's what else I want to know. Is everybody from this area? Yeah? You're from Wilmington? What's your favorite thing about Wilmington? The beach, right? Like, it's amazing, yeah. What's your favorite thing about your community? Where do you live? Wilmington. What's your favorite thing about Wilmington? Yeah.
So it's home.
It's home. What's amazing about your community? Anybody at your table, what's amazing about your community? Yeah. What's amazing about your community? Yeah, so every single community has such amazing things happening, and it feels good. And when we are proud about our community, we like our community, we want to feel a part of a community. So families all want to feel that, right? Like, you light up when you talk about your community. When I ask, like, what's great about, Sharon, what's great about your community?
I live in Durham, and we're both a foodie town, and we're an incredibly diverse community. I really love what you had to say. We are able to come together across income and race and religion and work to make things better for our community. And there's that spirit, that Bull City spirit, that we can get things done when we come together and support one another.
Yeah, and I live in Johnson County, and it's a small town, and I grew up in, I was born in New York. I grew up in New Jersey. But I can say y'all. Anyway, it felt so much calmer to raise my children in a small town area. That's what I wanted, and it still feels like that. I go to the store, I know everybody. I go to the Walmart, and they're like, Miss Beth, and I'm like, hey. You know, and the kids I raised all three of my children there, and so I run into the kids, right? Like, I run into the kids that grew up there, and it feels like home. We want that for the families that we work with, too. So how do we get there? Research indicates that the absence of positive childhood experiences are actually more damaging than the presence of ACEs. What we just talked about was positive experiences, but the absence of that is more damaging than the presence of ACEs. So if you don't have a sense of community, if you don't have a sense of belonging, if you don't have that positive experience, it's more damaging than those ACEs that y'all know all about. So we're going to talk about a little bit about how to build some of those. Is that even surprising to you? That's a little bit like mind-blowing to me. And I do have some more research on that, which once we go through this, you're going to be like, come back and do a training.
Yes, that's right.
All right, so what are these little building blocks of hope that we're talking about that are like, ooh, tell me more, Miss Beth? So we're going to talk about the 4 building blocks of hope. This is not, again, rocket science, right? Any pediatricians here? Or, like, do you all work with any pediatricians? When a child is okay, yeah, I saw a hand. When a child's about 1 year old, they make them do this little block tower. They have to build 4 blocks. That's it. It's all it's all these building blocks are, 4 blocks. Toddlers have to do it. So to be sure, we can do it. I know we can. Their relationships, safe, equitable, stable environments, social and civic engagement, and emotional growth, y'all. This is the building blocks. So we'll talk about each one if I get the clicker right. The first one's relationships. It's my favorite one because without stable, nurturing relationships, we have nothing. And that's grown-ups, children, that's humans in general. We are not meant to be islands. We are not. So stable relationships, we can start them in infancy with good attachments, and we can continue them on. The problem is when you get to be a grown-up and you've never had one, it's a little harder to kind of get them. It can happen. It's just a little trickier and a little bit more work. Some of the ways that you get them now, some of the programs that you're working on, some of the activities.
Yeah, I mean, we're in a faith community right now, and a faith community is where a lot of relationships get built. In our neighborhoods, our children develop relationships at school. That's often where parents develop relationships with other parents, is where their kids are. There are playgroups. There are lots of different places that we can build relationships. And when folks have already experienced adversity, sometimes it's those support systems that are then helping us, like at the Carousel Center, where more relationships can get built.
Mm-hmm. I heard earlier, too, like some support groups. And I think some of y'all probably do, like Circle of Parents or Incredible Years, or there's some...
Triple P.
Yeah. So there's lots of ways to build those relationships. There's with kids, little kids, they do them through preschool classes, mommy and me classes. They make friends. You know, you make a friend.
That's really what when we say stable, nurturing relationships, we're talking about building friends.
Yeah.
We don't need to make it rocket science.
No, we don't need to complicate this, right? Like Sharon was saying, it's not rocket science. You make friend. How hard is it to make friend as grown up? Yeah,
it's hard.
It's a little harder. We have to kind of facilitate that. After you leave school, high school or college, it's a little trickier to make friends. Work environment is one way. But if you don't have that, you may feel isolated, and it may feel a little bit trickier or a little bit, you may not just go up to like random, little kids do it great. They just go up to random humans and be like, be my friend. I do that still though, y'all. I don't know what that says about me, but I do. Whoa, do you want to be my friend? Yeah. We have to encourage that a little more in the people that we're working with.
Yeah, we know connections matter. That's another
Connections
thing.
Connections matter. You'll hear about that.
Yes.
Yes. Okay, I have to watch time too, because I can. All right, environments. Environments matter. Here's where, who does home visiting? Lots of home visiting, yes.
Yes.
We love home visiting. Safe, equitable, stable environments for living, playing, learning at home and school. We are on a tax-based school system, meaning that you pay taxes and goes to your school system, that kind of stuff. That doesn't always work well.
It means it's different in every community in North Carolina. It depends on the size of your tax base. So what you're able to do here in New Hanover County in an urban community where there are a lot of people is really different than what you can do in Gates County, where the population is really small.
Yeah, so it's not always equitable, so it may feel different. I noticed it a lot when my kids, my boys especially, or playing sports. Gosh, they're grown-ups and gave me kids now, gave me grandbabies now. But when they were playing sports, they even noticed it. They'd be like, they had a brand new school actually, and so they had this big, beautiful gym with, all this new bells and whistles, and some of the older schools that they would go play at that they didn't, or maybe some of the more rural areas that weren't as well funded. And it was noticeable that the inequities. So equitable environments make a difference.
It's housing. It's
Yes.
the playgrounds that we build in our community. It's our parks and rec programs. All of those things are part of that ecosystem that supports families.
Yeah, the ecosystem that Sharon was talking about in the beginning. So the safe, stable environments is another building block that we can work on. These are solvable. These are tangible things that we can work on together as a community. The engagement one. I love the engagement one because this is again about belonging, civic engagement. Being a part of something like a church, being a part of a organization like a nonprofit, giving back to the community, serving, working on connecting.
Being a part of your local Rotary, being a part of a neighborhood committee or your neighborhood association. All those things are places where families can come together and feel a sense of belonging and have ownership in what their community is like. And it means we'll invest more of ourselves and we'll invest more in our community.
Yeah, and with kids, it means that, having available in your community like the Boy Scouts and Girl Scouts or whatnot. Don't forget, we have that caveat, the big and, because we know things. We heard in the presentation before, we know not nice things happen too. So we're not negating that. Safe, stable environments, safe, stable relationships. So we have to work on what's in front of us too. And that's not always a good thing. We will talk about that for a minute as well.
And I just want to reinforce too that civic and social engagement is really about building community, and it's what you just heard in the last presentation. The context that supports community is one of possibility. It's about generosity. It's about the gifts that we can bring and using that positive focus. And we tend to focus on problem solving or fear and retribution when we're talking about programs that support families sometimes that have really experienced difficulty. When we talk about the possibility, the generosity, and gifts, we're building that community that we want for everybody.
What if we shared that? Right?
What if we talked about that more?
Yeah, wow, okay. Little kids know how to share, or at least, we're teaching them. We are teaching them. They go to preschool, and then they go to kindergarten, and we're like, share your toys. Okay. Well, do we? I don't know. Do we share our information? Do we share our data? Do we share our resources? Do we say, oh, I got this big old grant, and wow, maybe, we should share the wealth in our community. What does that even look like? I don't know what that looks like because nobody does it.
But we want them to.
We could do it. It could happen. This is that realm of possibility, that realm of hope that says what's possible. And taking that fear away that says, well, what if I don't get enough? And then the emotional growth building block. I love this too. I just love that whole play, self-regulation. Again, the grown-ups. We love the grown-ups. How many know not self-regulated grown-ups? Yeah. Yeah. They can get self-regulated. We want them to get self-regulated before they end up in the programs the incarcerated ones. We don't want them there, right? We want to try to prevent that. We want to try to get them through playing and interacting, and we really, really want to get that right, that emotional growth and that emotional well-being, and we want to work together to form those healthy emotional. How do you do that, right? How do you do that? Name feelings. Who knows grown-ups that can't name a feeling or even talk about one? Yeah.
Lots of nodding heads.
What about like those grown-ups that can't cry? I cried this morning. I cried last night. I mean, I cry all the time. I'm a crier. But I laugh too. I like to laugh. I like joy. I've recently learned how to live in the and, that paradox of that return, that the science of the positive that we were talking about. There's the and space that says that we can be full of joy and feel all the grief and tragedy, right? We can feel somebody else's pain and know there's hope. So I've been learning how to live in that and space. There is a lot going on out there, friends. There sure is. And there's a lot of hope. So I've been learning how to live in that and space. It's not that easy. But I'm practicing, and I'm practicing. So we know families are resilient, hope celebrates their strength, and it's worth doing. So just real quick, I want to talk about what goes into like these buckets, the blocks, the buckets, whatever it is. It's not up to you to decide. That's the kick. It's up to the communities and the families. Because what I think like is great ideas to put into the bucket, somebody's going to be like, it's a little weird. I don't think you should do that. Or like, we live in the mountains. What are you putting sand in my bucket for, right? Like, or, we're at the beach. Why are you collecting pine cones? Or maybe you want to. I don't know. But it's not relevant. So if you don't ask, don't put it in somebody's bucket, right? Like if you're thinking about, the community needs this. We need a festival. We need a this. We need a that. And nobody comes. It's probably because we didn't ask. And it's not what maybe what's needed right now or what's wanted. So always ask. What I think is a great idea may be triggering to somebody else. So it's just a little like caution, we don't want to assume what somebody's building blocks might be. Anything else on that? Like to kind of just a caution?
Well, I would say too that as we talk about how we engage with families, we should always be asking folks that have experience in the systems, that have experience with adversity, to tell us first how that's going for them, what we can be doing different, what we could be doing better, and most importantly, what do you need? What do you need for your family to feel strong and thriving? Too often, we come in as the professionals and think we know what the answers are, that we're the experts, we've gone to school, we know all the jargon, but we really need to be listening to the folks that are living this day to day and hear what would be most important for you, what would make a real difference for your kids, what would make a real difference for your family.
Yeah, absolutely. And, I've done direct service. I know how hard this is. I know what it feels like when you, I know what it feels like when things don't work out the way you think they should. I know what it feels like to go to a service when it doesn't work out the way you think it should. I also know what it feels like when it's successful, right? It's those successes that we want to build on. there's a lot of research behind this, y'all. We just gave you a tiny, tiny little taste of hope. There's tons of research that really brings into play that says the more positive experiences we can build, the more we're combating the ACEs, and the more we are going to have success in the communities. So I really want to make sure that that is heard.
And I really want you all to, as we're finishing up and get ready to answer any questions you have, I want you to be thinking about what was positive for you in your childhood. We recently did we had a little fundraising event where we asked everyone who attended to share one of their favorite positive childhood experiences, and we created a mural as a result of it. And it's absolutely stunning because it's things like, my grandma read to me before I went to bed at night. I got to hang out at the neighborhood pool. I got to bake cookies with my mom. My dad sang to me at night. Those are the kinds of things, that's the spirit that we're trying to evoke here as we talk about building positive childhood experiences and building hope. It's not rocket science, but they're the things that are often really, really hard for families that are overloaded with all kinds of stressors, from the trauma that they had in their own childhoods to the difficulty they have finding affordable housing or putting food on the table. But when we can sit back and talk about what was good in your life, what really made a difference for you when you were a kid, and think about what can we do to make that possible for every single family here in Wilmington and all across North Carolina. That's what we want.
Thank y'all for listening and for being rock stars. We appreciate everything you do every single day.
And please ask us questions and know that our agency exists to support North Carolina. And if you want us to come, Beth can come and do a training on this and spend hours talking about this. 50 minutes is not enough time to talk about what this is really all about. We can train your teams. We can come and provide all kinds of support and have a whole suite of different trainings that we can provide to your agency.
We can, and they're a lot of fun. And, people think positive, a lot of times they think about the work that you're doing is not fun. And it's not always, but sometimes the solutions can be, and we can really get there. We can really think about that positive in a different way and think about those creating it differently, yeah, right? Like creating it differently.
Yeah, we need to transform our conversations in the community about what kids and families need, because it's often not the programming, it's the support, it's the connection, it's the opportunity to have positive experiences. So what questions do y'all have? Somebody's got to have a question. We do. We're located in Morrisville, but our staff mostly, I'm usually like one of the only people who's ever in the office. Most of our staff work from home, and we literally have staff. We have someone who lives in Wilmington, we have folks who live on the coast, we have folks in the mountains, so we can go anywhere. We'll come to you. We don't ask you to come to us.
I like in person better, y'all. I mean, I can play online, but
connections matter, y'all. We need to be in the room with each other.
Awesome. I know that we're a couple minutes over. I apologize, and yeah.
And I want to encourage you to visit with our colleagues at the table that we have outside too. You can learn more about who we are and how to get connected with us. We really want to be here to support all your agencies to make North Carolina a better place for our kids. So thank you all very much for your attention.
Thanks.